Good morning, everybody. Welcome to Doc Dynasty. I am Dr. Poe Raval with over 35 years experience as a private practitioner. And today we are going to be expanding on what you can include in any level of practice based on the 7 paradigms that affected medicine and are making it more successful for physicians. Number 1, we have moved from a disease-centered approach to patients to more of a patient-centered approach. What does that mean? That means someone would come in with an issue. We would have this standardized format in which to treat them. Nowadays, as we know, our patient intake forms have become extensive. And why is that? Because we are looking at the whole patient. This patient is experiencing these symptoms, but let's look at the whole picture, what medications they take, what other specialists they see, what their genetic history is. All of these things come into treating that patient. Disease-centered to patient-centered. Number 2, we have moved from standardized treatment protocols to personalized precision medicine. What does that mean? So instead of, once again, looking at all the options that we have based on a diagnosis, we now look at how can we, with all the knowledge we have on a patient, how can we tailor that treatment to that patient based on their genes, their family history, risk management, past diagnoses, the whole picture. Personalized precision medicine is absolutely the future of medicine. And if you're not doing it yourself in any form, invest in companies that are. The catchwords and the companies that are doing this are genomics companies and molecular, and ones that are using molecular technology, meaning they're looking at the molecules, devising treatments based on the shape and access points to develop a therapy. So genomics, molecular technology are definitely where you should be investing. Number 3, technology and digital health. As we all know and hate, we now have EMRs that have extensive amounts of checkoff lists that we have to do for each patient. But the benefit of that is that we now have a full file that can be shared with other practitioners in order to solve a disease process for a patient. So we're using technology and digital health. That includes telemedicine. It includes EMRs. Wearable devices like heart monitors and sugar monitors that are incorporated into patient charts. And in the future, it will be AI based. So more on that and AI, but it's all technology that we can harness for our practices and how we practice. Number 4, we are shifting towards value-based medicine. Now, we've talked about this a lot. We have to fill out lots of paperwork that incorporates value-based medicine. But what does that exactly mean? That means that we're not just looking at the patient and whatever we need to do, we do for that patient. We're looking at what we're doing, how it's affecting outcomes, and how much does it cost. So these are things that you need to do to make medicine more efficient. So efficiency counts. That's what value-based is, that what you're doing makes sense, reduces costs, and helps a patient get better faster. Excuse me. The next big paradigm shift now is also on, instead of treating a disease, we're making predictive models. So what does that mean? That means instead of treating a disease, we're treating the risk of getting that disease. It is more preventative. We're trying to get you way before that disease process happens in a patient. That's how medicine and doctors should be looking at any disease process. Let's look at the risk and let's prevent disease. So more preventative model. Next, critical care, what I've seen in ICUs when I get called down or I'm on call, is that it's more of a collaborative process. It used to be a doctor's assigned, you treat that patient leaves the hospital. Now because we're looking at the whole patient, we're not just treating that disease that brought them into the ICU, but we're using a team of nurses and physicians and experts to solve the problem, to look at the risk, and help that patient once they leave the ICU. Lastly, as I just talked about, genomic medicine, I can't emphasize it enough. It is going to be the future of all disease processes, because we will be able to target a disease process for a particular patient in a way that makes it cost effective. So it's taking all these paradigms and it's tailoring it to a patient. It should be effective. It should be patient focused. Hopefully the costs will come down on it. It will be based on their gene history, and the risk of getting a disease. So if you're not in a position to do that now or to test for it, invest in companies that definitely are working on those kind of technologies. All right, I hope this is helpful and hope you can incorporate it into your practices.